Welcome back to another enlightening episode of The Truth About the Plant, the show that takes you on a journey through the world of psychoactive plants and alternative wellness, all while delivering the real, actionable insights you crave. I'm your host, Christina Dees. This is my equally talented co-host, Dr. Amanda Ryman. Dr. Ryman, you want to tell them why we're here?
Absolutely. So we're here because it can be really difficult to find good, accurate, useful information about cannabis on the internet. You might do a Google search, you get back 100 different answers, many of which contradict each other. Social media has pretty much stifled our ability to do good, quality education about cannabis. So where are you going to look? Well, we're here to give you actionable insights, real answers, truthful answers based on science, all in 15 minutes or less, so that you can get what you need to know in order to have a safe, healthy relationship with cannabis. So think of us as your kick-ass granddaughters, your trusted aunties, the ones that are always going to give you the honest truth.
That's right. We'll shoot you straight. Well, welcome, green-minded ponderers, to a dilemma as hazy as a smoke-filled room. Should you reveal your cannabis consumption to your trusted physician? So join us as we embark on a journey through the highs and lows of doctor-patient honesty and today's burning question: should I tell my doctor that I use cannabis? So as you know, I live in a state without legal access to cannabis, but I do consume for therapeutic purposes. Should I tell my doctor that I use cannabis?
Well, I think you really hit the nail on the head in your intro about trusted. A lot of this comes down to how much you trust your healthcare provider. So I want to begin this conversation by acknowledging that disclosing something like cannabis use to your doctor is a different level of risk depending on who you are. So women and people of color are treated differently in the medical world, and therefore the risks of being identified as a cannabis consumer are heightened for these groups.
Okay, well, let's start with women. What are the increased risks for women?
Well, women's health, unfortunately, is generally not taken as seriously as men's. As a result, they're often misdiagnosed or underdiagnosed, and their symptoms may be written off as psychological, so they don't get the tests or care that they need. And on top of that, our society has a very paternalistic relationship with women. This means that those in power feel that they have the right to dictate what a woman does with her body, especially if she's a mother. So women with children may be viewed as unfit if they admit cannabis use, even in legal states.
I can definitely relate to that experience. So, what about for people of color?
Well, similarly to women, people of color also experience health disparities and unequal treatment. So, beliefs about certain groups' abilities to make good healthcare behavior decisions can lead to the same underdiagnoses and paternalism as women experience. And as you can imagine, women of color experience some of the greatest health disparities because of the intersection of their gender and ethnicity.
Yeah, we can go off on a whole nother tangent and a whole nother podcast, but um, sticking to the topic, how does someone know it's safe to talk about their cannabis use?
Well, this goes back to the trust that you mentioned earlier, right? So I think it's important to listen to your instincts and to gauge the level of trust that you have in your healthcare provider in context of who you are. If your doctor has given you other indications that they do not believe you, or that they're making assumptions about you based on your gender or ethnicity, you may not feel comfortable disclosing your cannabis use. And it's not always possible to choose your medical provider. So if the one that you see has not earned your trust, that is a good reason to be extra careful about disclosure.
Okay, and so what if you do trust your provider? What are some reasons to disclose your cannabis use?
Well, for one, cannabis is a medicine. So, just like other medicines that you list when you're asked to go to the doctor, there could be interaction concerns. So, certain medications like blood thinners or steroids may interact with cannabis, deeming them less effective. Some enhance the effects of cannabis. If you're having surgery, you may want to disclose your cannabis use to your anesthesiologist because there's some research out there that suggests that cannabis users may require a higher level of anesthesia. However, if you're a healthy person who's not on medications or having surgery, there may be less of a reason to disclose your use. And of course, the legality of cannabis in the place that you live is a factor as well.
Yeah, I think this comes up a lot in the older population because I think they have interest in using it, but they also don't know how to have that conversation with their physician.
Well,
So,
absolutely. I mean, this is a generation that grew up in a time where cannabis was still highly stigmatized and highly illegal. And unfortunately, they're also the population that is going to be using the most medications. And so, again, we get back to that kind of interaction. And if you're on heart medicine, or as I mentioned, blood thinners, like there are some potential risks to cannabis. And so you want your doctor to be aware of those risks. But I will say, the tide is turning and there are more doctors that are comfortable with their clients using cannabis, especially their older clients, because they know that they may be using it instead of alcohol, which poses a higher risk. They know that they may be able to use it instead of other medications that pose a higher risk. And they know that cannabis can be good for pain, for sleep, for anxiety, which can also be more commonly found in the older population. So, if you're someone who's out there and you're part of this older generation, let's say 65 or older, you may want to consult with your child or your grandchild about what's the best way to have this conversation.
okay, so when might this come up? When might this kind of conversation come up with a healthcare provider?
Well, if you're using cannabis as a medicine, again, you're going to be asked when you go into your doctor to list all the different medications you're taking. I list cannabis as one of my medicines, and not just with my primary care physician, but with my dermatologist and my dentist. I live in Northern California where cannabis use is common and legal. So besides it being on my medication list, my doctor also asks me about cannabis when she asks about alcohol use. So, your doctor will say, do you drink or use any other drugs? And my doctor will say, including cannabis. And so that's another opportunity to bring up the fact that I do use cannabis. I've also had multiple surgeries, and my anesthesiologist has asked me specifically about whether I use cannabis. Again, use is very common where I live. So I remember the last time before I had knee surgery, and the anesthesiologist asked, do you use cannabis? And I said, yes. And he said, okay, that's a very common answer here, which was in, Sonoma County, California. And then he advised me to abstain from cannabis for at least 4 days prior to surgery. So I was able to get that advice to make sure that my surgery was going to go smoothly. But if I had it disclosed, then he wouldn't have been able to tell me about that advice. So again, this is common practice where I live. But if you live in a place where cannabis is illegal or less common, first of all, you may not be asked, right? Because there may not be an assumption that somebody uses cannabis. And you should give more consideration about whether you disclose your use. And so I want to also quickly mention that this also extends to mental health professionals. So not just physical health professionals. So this is the same advice. Cannabis can interact with certain mental health medications, and your cannabis use may or may not be relevant to the symptoms for which you're seeking mental health care. But disclosing can still be risky. And this could be because of beliefs that your mental health professional has about the role of cannabis in mental health. They may, misappropriately blame cannabis for the symptoms you're having and focus on that as a way of giving you treatment when that's really not related to it. So again, it goes back to trust. What you may want to do in the mental health space is kind of get to know that provider a little bit better, develop a therapeutic relationship with them, kind of feel them out to how they feel about some of these drug use in general and cannabis use, and then make the decision about whether or not you want to disclose.
Yeah, and in my experience of the patients that I've worked with, they are hesitant to disclose because the doctors don't have the knowledge to help them. So they feel like even if I do tell them, they're not going to be able to help me know how to take it in conjunction with maybe some other medication, or like you said, like coming up for surgery. I love that you pointed that out because it is really important, due to the interactions from surgery and afterward too.
Well, you bring up a great point, Christina, which is that even if you disclose your cannabis use to your physician, it's very unlikely that they've been trained in cannabis as medicine. They may have had a cursory understanding of the endocannabinoid system. They likely were not taught about it in medical school. And even though I would love to say, bring a bunch of articles with you, I also know that doctors don't like when their patients are smarter than them. So that may not be a way to get them to think about you as a medical cannabis cannabis consumer. Now, we're going to do a future episode about specifically working with a cannabis clinician. So in a lot of ways, you're going to have two sets of doctors. You're going to have one that's very familiar with cannabis, that's advising you on your therapeutic use of cannabis related to whatever condition you have. And then you're going to have your other doctor who might be treating other conditions and issues that you have that may or may not know that you're using medical cannabis. And this is one of the reasons why we really need to normalize the use of medical cannabis. We need to encourage education for physicians about the use of cannabis as medicine so that this doesn't exist in a silo and it's not your medical cannabis clinician over here and your other doctor over here, but instead they're working together through a continuum of care to make sure that your cannabis use, therapeutic or recreational, is in line with your other health and wellness needs.
And that is why we are the cool aunties. We shoot it straight. So I love, yeah, tune in future episodes. We're going to have some good stuff coming up and also some really exciting guests. So as we wrap up this cannabis infused consultation, remember, honesty is the best policy, even when it comes to discussing your herbal habits with your doctor. Your health journey deserves clarity and transparency. Add some zest to your inbox with our cannabis curiosities. You can sign up for our newsletter, mypersonalplants.com. You can even email us at info@mypersonalplants.com. And if you're yearning for more herbal enlightenment, indulge in our YouTube garden of knowledge. Don't just observe, click that subscribe button, show us some love with a thumbs up, chime the notification bell, even leave a comment. And if you like this episode, please share it with a friend. Until next time, stay lifted, stay informed, and may your medical mysteries be solved with the touch of green wisdom.